From Toyohashi in Japan, welcome and thank you very much for presenting.
Thank you for the introduction. And my disclosure. Vaccination against COVID-19 started for all citizens in Japan from February 2021 if they are receiving glucocorticoids or other immunosuppressive treatment. COVID-19 vaccine is especially recommended according to recommendations of ACR and EULAR. Considering the actual clinical situation where there are patients who actively vaccinate, we encounter patients who choose not to be vaccinated for various reasons. Real-world clinical information on patients thinking about COVID-19 vaccine is necessary for better relationships between our patients and their physician. Patients and methods. This study utilized data of 610 our patients. Patients' characteristics, changes in COVID-19 vaccination rate up to 3 doses, frequency and content of adverse reactions, excluding injection site pain, because injection site pain is very common, and reasons for non-vaccination of non-vaccinated patients were investigated. Result. Mean age was 67 years old. Mean age was 67 years old. Percent female was 75%. Mean early duration was 14 years. MTX was used in 59%. Prednisone was used in 12%. And bio and JAK or JAKI was used in 48%. Results. Regarding type of vaccination, Pfizer products were more than Moderna products. However, the number of Moderna products increased in the third time. Regarding changes in COVID-19 vaccination rates significantly decreased over time. Regarding trend in COVID-19 vaccination rate by age, significant change observed in the 0 to 64 years old group, but not in the 65 to 74 years old group and the 75 years old or above group. Comparison of non-vaccination rate by age is shown. 8.4% of all patients was non-vaccination. In the 3 groups stratified by age, significant decrease in the rate of zero vaccination with increasing age was observed. Adverse reaction rates are shown. 25.9% of all patients experienced adverse reactions. In the 3 groups stratified by the number of vaccinations, a significant increase in the incidence of adverse reaction as the number of vaccinations increased was observed. Details of systemic adverse reactions are shown. Fever, fatigue, headache, and were top 3 in each vaccination. Details of reasons of non-vaccination are shown. Side reaction concerns were the most frequent reason of non-vaccination. Discussion. We can see COVID-19 vaccination rate in Japan in the Prime Minister's official residence homepage. Overall, about 80% have been vaccinated once or twice, and the vaccination rate was higher among elderly people aged 65 and over. Overall, the vaccination rate had declining since the third time, and the decreased trend was clearer, especially in younger generation. COVID-19 vaccination coverage in the major countries around the world from One World in Data homepage is shown. At least one vaccination rate in Japan is comparable to Brazil and South Korea, and slightly higher than the US, France, and the UK. In terms of booster vaccination, Japan has considerably higher number of vaccinations than other major countries in the world. Here is Japan. It is thought that public funding for vaccination, educational activities by Japanese government and mass media, and the national character of the Japanese people affect the result. Adverse reactions of COVID-19 vaccine in rheumatic disease were published in several studies. No clear differences in the content or frequency of adverse reactions were found between the rheumatic disease and the control groups. Although disease activity worsened in some cases, the impact of vaccine is unclear. In this study, many patients refrained from receiving the COVID-19 vaccine due to concerns about side effects. Internet article covering NHK News is shown. NHK is Japanese national TV company. A woman aged 40 died of sudden change in her condition immediately after being vaccinated at Aisai City near Toyohashi City. Such news was thought to influence patient choice. In summary, COVID-19 vaccination coverage in 610 patients was gradually declined, and the tendency was stronger in younger people. Fever, fatigue, and headache were the top 3 systemic adverse reactions to COVID-19 vaccine, and their frequency increased with the number of vaccinations. There are 51 cases, 8.4% of 0 doses of vaccination, and the most common reason for non-vaccination was concerns about adverse reaction. I would like to thank Dr. Saito Korea for collection of information about COVID-19 vaccine, Ms. Sono, a secretary for summarization of data, audience for listening to my presentation in English, and Google Translator for helping my making presentation slides. Thank you. Thank you all.
Thank you for the very nice presentation. Questions, anybody from the floor? If not, I have a couple of questions just to ask. So the rate of vaccination against COVID-19 is very high in Japan. You showed that. Is that the same for all vaccines in general, or do you think there is something different about COVID-19?
Pardon?
So is it the same for other vaccines?
Other vaccine, for example, influenza, or
yes. Is it the same?
I don't know the rate of vaccination of the influenza, so maybe, but the Japanese tend to follow the rule or what another people do. So and very conservative. Yes. So maybe Japanese people vaccination rate will probably be high. Okay.
And I have one more question. It's about when people have the COVID-19 vaccine in Japan, do they stop the methotrexate?
Depend on treating doctor.
Yep.
I advise patient as ACR guideline teachers. Yeah. So I say stop methotrexate. But another teacher, another doctor don't do that.
Okay. Okay. Any other questions? Thank you very much.